Alessandra is a veterinarian with a PhD in epidemiology and zoonotic diseases, and she's a professor at the University of Bologna. Her research focuses on One Health, emphasizing human-animal ecosystem interactions and diagnostics in low-resource settings. She was honored in 2023 with the One Health Award as Italy's top scientist in the field, and she's also a member of the key global health advisory groups, including WHO's One Health Working Group on Skin, Neglected Tropical Diseases, and of the zoonotic poxvirus expert group for European Discontinuous Initiatives. So you can tell us what that is. But thank you very much for joining us, and we're looking forward to your talk.
Thank you for the invitation, and thank you for coming. We will guide you in deep dive what we think is a living lab for One Health. So I'm just going a bit out of my comfort zone. There are more pox viruses, but I will try to explain what we are trying to do to engage different stakeholders to work in a proper way to prevent vector-borne diseases, especially, but not only that. I will also tell you very shortly something about another climate-related infectious disease, because I will try to introduce the team, and then we go into the living lab just to show you why this living lab has a meaning, because we were affected by extreme weather events in the last 2 years, and so we know what may happen after this kind of event. As you can see here, we are also a member of Europa, that is a university alliance from Europe. We are funded by the European Commission, and we are the only alliance of 11 research-intensive universities with a One Health focus area. So this is more or less my outline. And yes, of course, we wanted to focus on climate change because Wits, together with Bologna and other universities, are included in an initiative that is Gildarwa, and one of the focus area is climate change, and we are struggling to include health into this topic because we think that matters a lot. So I think I don't have to go through it, because you know what climate change is, why climate change is there, what we are doing to our planet, and why we are now suffering about the effect. So I just wanted to mention that last COP28 was the only one that mentioned for the first time the effect that climate change can have on health. And so in the final statement, you can read it, we, on the occasion of the first Health Day on the 28th UN Climate Change Conference, expressed our great concern about the negative impact of climate change on health. We stress the importance of addressing the interaction between climate change and human health. So this is a good first step, but very ecological. So we matter about humans, but we are not considering the other living being on the planet, and we are observing effect of climate not only on humans, but also on animals, plants, and all the living beings on this planet. So we will try to figure it out. So we, with a One Health approach, we will try to go out of this view that is very ecological, and it's not really One Health, to try to adopt an ecological way of seeing and analyzing the situation. Okay, so this is a scheme that comes from the One Health high-level expert panel that depicted these as the main causes that enhance the interaction between animals, wildlife, and domestic, and humans. And these are also known as the cause of spillovers or emergency in our field, that is mainly infectious diseases. Indeed, deforestation is very important. Our cities are becoming wider, and also agriculture is becoming wider. We produce our crop and despite the forest, so we have to cut down trees. We produce our food in an industrial intensive way, and also we waste a lot of food, unfortunately, and this is another very big issue of the Anthropocene. So intensive agriculture, intensive animal production, we know that this intensive way of producing things is also affecting our planet and climate. And then indeed pollution, urbanization, and migration. Migration, it's a very important part of the story, because we tend to think that migration only affects humans. Indeed, a lot of people are moving from one part of the world to another because of climate, but also because of war. But I want to underline that migration is something that happens also for animals. So we tend to think that spillovers are always from animals to humans, but many times spillovers happen in between different animal species just because one of them changed their habitat and tried to find a better place to live because it's too hot and they have to find water and food. So animal translocation is something that we tend not to see, but it's happening. So animals are moving, so the situation and the interaction are much more complicated. Indeed, climate change is a big issue for all these factors, and it's complicating all this framework. So I don't know if you know this document, but I think it's very key. This was published in October 2022 by the World Bank, and it was just after the pandemic, and they have underlined these key issues like core domains of the effect that gives as an effect the emerging of infectious diseases and with pandemic potential, but they have also underlined the importance of climate change, and they underline the fact that we don't suffer all in the same way because of climate change, because there are inequality, fragility, and violence that can affect the whole system. So there are people that are suffering more than others, and there are animals that are suffering more than others. So we are not equal in this sense. So this is what I was saying before. So migration is a big part of the story. So when it comes to climate change, we all try to find a better place to live, to find what we need to live. So we cannot live without water, without food, and so on. But this happens also in the animal world. As human beings, sometimes we overlook this, but this is another very important part of the system. So I like to show you this, and I always show this to my students at the very first lectures, because as human beings, we tend to think that we are the most represented animal species, or at least biomass on this planet, but it's not true. So over more or less 550 gigatons of carbon on this planet, 450 are plants. And we are a very tiny part, so we are 0.06 gigatons overall, and our domestic animals are many more than us, and wild animals are less than wildlife. Wildlife is less than domestic animals. Which are the other biomass most represented that comes around 70 gigatons of carbons? Microbes. So microbes are many on this planet. They are mainly in the water, mainly in the ground. We, as human beings, we tend to think they are pathogens, but they are not only pathogens. Many of them are so useful for our health. We know microbiome, not only in our gut, not only in our skin, but also in the ground, in the water, and it's so important. But it's also something that influences AMR spread. We know that many microbes, are happy to share their plasmids, so we know how much AMR genes are spread in the water and in the ground. Okay, so I would like to underline another very important part of the story. So half of the animals on these planets are these guys here, arthropods. So 1 gigaton of carbon over 2 that consist of animals are arthropods. So it is not surprising that we are observing an increased incidence of diseases that are vector-borne. And we need to think about, because there are not so many experts in entomology, not so many experts in this field, but probably this is one of the disciplines that we should focus on in the near future. I want also to show you this because I want to prepare the scene for my living lab. And I think this is a very interesting depiction of the system, so where the spillover are more prone to happen. And this is the ecotone, so the intermediate area in between the wild and the urbanized settings. Why? Because here, wildlife and domestic animals and humans are are much more in close contact. When a new disease, especially new pandemics, start, and we are always blaming wildlife. Why? Because humans are very prone to, not having any fault on what happens. But many times, because of the quantity of domestic animals that we have, the jump is not direct. And as you can see there, many times the jump is from wildlife to domestic to humans, and not direct. Okay? And this is because domestic are so many, and it's so easy for them to be in touch with wildlife. There are some beautiful photos in the Amazon, or near the Amazon, where you have cattle that are just grazing in, close to a forest, and they can be in touch with many different wildlife that have lost their home because of deforestation. And also another intermediate, or other intermediates, are arthropods, so mosquitoes, ticks, and others. So this is very important. And we need to consider that, because when we manage our domestic animals, they are not just food, sometimes they are just the intermediate of this kind of effect. So what about Europe? What is happening there? What about Italy? Because we are in Africa, so maybe you don't know so much of what is happening. I come from Italy, so I come from the south of Europe. I'm inside the Mediterranean. We are just a bridge in between North Africa and probably Germany, Switzerland, and so on. And so we are quite exposed to climate change and what happens in the Mediterranean at the moment. That is not just climate change, unfortunately. So in the last version of the Lancet Countdown, I don't know if you are familiar with this very interesting publication from the PCC group and so on. They have warned about the extreme weather events and climate change and increased temperature that we are experiencing in Europe. Unfortunately, we all observe what is happening. We know that we are tropicalizing, especially in the south. During the summer, it's really hot and really humid. It's like, being in a tropical country. Despite that, we cannot really stand the limit that is 1.5 degrees. We continue to produce a lot of greenhouse gases, and Italy is fourth in the row. So we produce 6 times more than Africa overall. Not Italy, but overall Europe. So we are not very good. So we know that we have a problem, but we are not really acting. So this table here, I think, is very nice, especially in a Gilda context, because these are all the indicators that Lancet Countdown defined related to the impact of climate change on health. And if you see, 1.3 is related to climate-sensitive infectious diseases. So they have identified different indicators. Well, this is our field, but indeed you see allergens, you see heat exposure and others. We will focus on this. They have identified which are the infectious agents that are mainly vector-borne diseases that we have to monitor to link climate change to health effects. So when we see that we have a higher incidence of these diseases, we cannot deny that is climate change, okay? And so we have Vibrio, that is not an arbovirus, it's a bacterium that is in the water, and I will show you what we observed in our living lab. West Nile, dengue, chikungunya, Zika, malaria, leishmaniasis, and tick-borne diseases. So diseases that are linked to ticks. In our area, normally we had a tick-free period from November to March. Now we have ticks all over the year. And we cannot deny it, because we track and we see. Okay? So this is Europe. You see Italy is the boot, so you can recognize it. We are very prone to all vector-borne diseases coming from Africa. So it is not by chance that we have blue tongue. When I was a vet student, blue tongue was an exotic disease. Now it's very endemic. Leishmania was an exotic disease. Now it's endemic, and so on. Also, West Nile was very exotic, but now it's very endemic, okay? So we are surrounded by sea, and you can imagine that we are also very prone to waterborne infection due to climate change. So arboviruses, you know everything about. I think I don't need to explain this. We know that according to the WHO, this is a major public health issue. They can go from fever and neurological symptoms to hemorrhagic fever. It depends which kind of arbovirus we are dealing with. Many of these are asymptomatic, so we are just observing the top of the iceberg, but we know that we have many more cases that we could see, because some of our patients are just infected, but they do not show any symptom. And with West Nile, we had a lot of problems with blood donation, because these people are just donating their blood and they don't know, they don't realize that they are infected. But then when you give their blood to people that are suffering of any disease or they are particularly vulnerable, they develop the disease. So WHO identified different priorities, different pillars related to arbovirus, and I would like to concentrate, well, they are all very important, so trying to monitor the risk and anticipating the risk, do a proper surveillance, strengthen vector control, and maybe acquire more skills in entomology. This is very important. Prepare for pandemics, but building coalition of partners, that is the key in my view, and this is why One Health matters in this field, because many different stakeholders are included when it comes to prevention of vector-borne diseases. We need a lot of expertise also on environmental science, and sometimes as medical doctors we don't care so much about the environment, but for these diseases we need to know a lot about environmental risk factors. So these are the most common arbovirus in Europe. So we have tick-borne encephalitis. It is quite common in Central Europe. There are some hotspots, for example, in Hungary, in Romania. We tend to have also in Italy. We have northeast part of Italy, not our living lab, where a lot of cases happen every year. In Europe, we have Crimean Congo hemorrhagic fever. Many cases were recorded in Spain, in Corsica, in France, and in the Balkanic area. We know that we have the good vector for Crimean Congo, but unfortunately we never recorded it in Italy. We have West Nile a lot, and many different flaviviruses, of which Toscana virus is the most impactful on the health of human. So I don't want to go into this, but just to see that they have identified 3 very important indicators according to the Lancet Countdown, so dengue, chikungunya, and Zika, and there is no country that didn't experience one of them. Why? Because vectors are translocating, and now they are very happy. We have Aedes albopictus for many years, and they are so happy to live in Italy. We have also Aedes aegypti, and we have a lot of people traveling. So when you come back from a travel somewhere from an endemic area and you are very weak, you can infect vectors locally and cause a cluster of cases locally. And we have observed this with chikungunya in 2007, a big outbreak in our living lab happened. So these are the emerging arbovirus in Europe. You see that some of them are transmitted by mosquitoes, different species. Some of them are transmitted by ticks and other by sandflies. And so these vectors are also common to other, for example, sandflies are also the ones that brings leishmania. So we are learning a lot because from a long time we do surveillance on these insects. And so we have discovered by chance a lot of flaviviruses also. And so these are the most important one as emerging arbovirus in Europe. So, just to show you, this is a very interesting paper that focuses on dengue, that is already a disease that is circulating and spread in Europe a lot, so even if it used to be an exotic disease, so maybe you experience a beautiful holiday in the Caribbean and came back with dengue, but now you can get dengue just locally. And in these pictures here, you see how many areas of Europe are populated by the vectors that are able to spread dengue. Last year we had a big cluster, and I will tell you something about this later. So, rising temperature linked to climate change, even if somebody do not believe, but it is like that. And many illnesses that are brought by travelers, because, okay, we have migration, but we have a lot of global travel. For work, for leisure, for other things, but we are coming back maybe with some fever, or we just feel very well, but we are very weak. Tick-borne diseases are not so quick to establish as we observe with mosquito-borne diseases. It takes some time to be introduced in new regions. Migratory birds may contribute, because sometimes they are the airplane or ticks, but we cannot always blame the others. Sometimes we are the one. So, okay, yes, migratory birds probably play a role, but we need also to consider that we are not doing anything to prevent this weather, this climate that allow the tick to survive a lot and overwinter in our case. So the first one is West Nile. You know probably everything. We used to have epidemic season, so normally we observe cases in human and in animal late spring until September, October. So for us it's late spring until the end of summer. As you know, it is transmitted by culex, and it is present now until northern countries. It was recorded in Finland, Germany, and everywhere. So we started in southern Europe, but now West Nile is just going up, as it happened with blue tongue. Blue tongue is a vet problem, so the virus is not able to be transmitted to humans. But if you observe what happened with blue tongue, then you could, speculate on what may happen with other vector-borne diseases. As we know, 80% of the patients are asymptomatic. Good for them, it's good. But we know that the virus is also able to be transmitted through blood donation and through organ transplant. So you can get this from somebody that is infected but completely asymptomatic. 20% more or less, at least in Europe, tend to just develop a fever. Many times these patients are they go out of the hospital with the diagnosis of fever of unknown origin. Because if you don't have neurological sign, they don't test for West Nile normally. Okay? Now we are trying to collaborate with medical doctors as much as possible to push them on testing also this kind of patient. And then, if, unfortunately, 1% or less is the neuroinvasive disease. It affects especially immune depressed patients and also elderlies. We have a lot of deaths, unfortunately, during the summer with this encephalitis. So these are the main environmental factors that influence the presence and abundance of the mosquito. This virus is a flyvirus. We know the important role that birds have, different species, because it's not just blackbirds, but many other. We know that aquatic birds are also very important, especially in wet areas. Horses are dead-end hosts, and in Bologna, we were the first to identify. The first case of West Nile in Italy was identified in the vet school because we had horses with these neurological signs. So we identified this horse that was, in fact, confirmed as the first case of West Nile in Italy, and then we started to monitor birds, we started to monitor mosquitoes, and so on. Indeed, humans play the same role in the epidemiology of this disease. We are all dead-end hosts, so we don't develop a viremia that is effective for infecting further insects. So the birds are the ones that are really the repository of viruses. So it is very important to characterize which are the bird species species that matters in a certain area because it's not maybe very different. And indeed, also the migratory birds have played a role to export the lineages from Africa to Europe, but now lineage 2, that is the most relevant one, in Europe overwinter, so we don't have to have the introduction of the virus from other parts of Africa or Europe, because it stays there in our birds, in our environment. Other animal species have been indicated as possible other and further dead and host. So the epidemiology, we are learning a lot about West Nile virus because now there is a lot of research around, but indeed birds are the amplifier host. And when a disease is circulating in the wild, it's not so easy to get rid of it. Here, just to show you what is the distribution of the different lineages, we started with lineage 1 that comes from Africa, and at the beginning it was like waiting for further introduction from Africa, but now we have this lineage 2 that stays there, is very happy, and it overwinters with our insect, because the insects do not die during the winter, because it's not cold anymore. So yeah, this is what happened in Europe. So we started in 1996, and then lineage 2 in 2004, and this lineage was very happy to establish. And then we had the record year in Europe with more 1,000 something cases in humans in different member states, and Italy was one of the most affected ones. But every year we have a lot, unfortunately, a lot of patients suffering of this infection. So this is now included in the regional preventive strategy. So the predictors, this is very important because West Nile, together with Leishmania, were the first push in our public health authority to promote a One Health approach to the surveillance of these diseases. So we have entomologists working with vets, working with human doctors to try to find as soon as possible the virus in the environment, because when you start to see it in mosquitoes, then you start to use some products to reduce the population of mosquitoes, which is difficult, tricky, especially in our area, because in our living lab we have wet areas that are very populated by birds and mosquitoes, so it's not easy. This is Italy, indeed, and you can see the red and the orange and the white. Where you see the red is that the virus was identified in animals, in mosquitoes, and in humans. Okay? Horses are more or less all vaccinated, except for the ones that are eaten. You know, in Italy we eat horse, unfortunately, and these ones are not the one that. So you see that in some region where the tradition, we have this food tradition, you can still see some cases in horses, while in others where we don't eat a horse, these animals are all vaccinated. It is very strange because we vaccinated horses, we don't have a vaccine for humans. This is something that you can maybe discuss. And then, okay, and then you have cases in humans, indeed. So this is the graph that was published by the Lancet Countdown, just to show you that West Nile is a very important indicator of the impact that climate change is having on health. Where it happens, so if we go back to this scheme, the main part of our patients or the cases are in this ecotone, so in the intermediate area that we have in between the wild and urban area. So our patients live in rural areas next to sometimes national parks or wild areas. And here you can see the peak of incidence that are always linked to our hottest season. And they are more or less all autochthonous cases. You see just very few red, all the cases are just autochthonous. So we are in an endemic area, we have some hyperendemic areas like our region or some other region in the northeast. Why? Because we have a big river there and a big delta river, and it's full of beautiful birds and insects. Okay? So the epidemiological surveillance on human is meant to quantify the burden and try to detect as early as possible all the cases, try to give a demography of the disease. So we want to know how many male or female are affected, which age, and especially who are the most at risk to have the most severe disease. And we know that are elderly and immunodepressed. And the environmental surveillance, this is very important. At present, this is just limited to wild birds and insects. There is not so much that is already in place on modeling the temperature, humidity, and wind speed, and raining, and so on. So there is not so much that is linked only to the environment, to try to detect the hotspot for the insects and try to be more prompt, not waiting to find the first insect that are affected, but try to have an early warning that something will happen very soon in that area, so we have to start soon to reduce mosquitoes in that area. So this is what happened until 1st October 2025. Our living lab is exactly here. Okay, these are the hyperendemic areas of West Nile. As you can see, male tend to be more affected than women, and this is the age, and you can see that over 75, these are the most affected ones. So the cases in horses this year and the cases in birds. So as you can see here, not everybody you find, not everywhere you can find infected birds. Meaning that probably we are looking for some bird species, but we are not looking for others, or there is another cycle that we are overlooking. So there is not dots everywhere, but indeed, where you have the hyperendemic area, you see that we have catched the most part of the infected birds. So infected birds are amplifier, we cannot deny it. And dengue. Dengue is something that happened very recently. We tended to think that dengue was just a very exotic disease, but now it's not the case anymore. It is transmitted to humans by Aedes mosquitoes. Unfortunately, we have a lot of Aedes albopictus. We have all the Aedes that are competent. So human to mosquito transmission can occur 2 days before the symptoms and after the recovery. It is very interesting to know that we have a lot of the world population at risk of dengue. It was estimated that 40% is at risk because of climate change and because of environmental areas that are quite, good for this kind of insects. We tend to think, of course, that monkeys are the animals that are, keeping the disease, especially in the wild, but we know from different studies that is not just monkey. Monkey play a role in the sylvatic cycle of the disease, but there are many other animal species that are related to this. So we are still in the Flaviviridae family. As for West Nile, flavivirus species is dengue virus. We have different serotypes, and this is very important to know because indeed studying the spread of the serotype is also important to know, or just to understand where the infection came, because the distribution of the serotype is not uniform everywhere. But also because when you are infected with one serotype, sometimes being infected with another one may cause very severe diseases. So the antibody-dependent enhancement, that is the cause of severe dengue. And also dengue is a fever, so you can just have fever and nothing else. So it could be that you have some patient going out of the hospital just with a diagnosis of fever of unknown origin. Unfortunately, there is a percentage of the cases that develop thrombocytopenia and shock, and these are mainly children. This is the distribution of dengue. This is a quite updated situation. As you can see, Spain, France, and Italy are colored. So we are becoming at-risk areas. We are already at-risk areas. We cannot say that we are endemic, but we tend to have increased number of autochthonous cases. So at the beginning it was just imported cases. Now we tend to have clusters that are just there with people that didn't travel. So yeah, these are the estimation and what happened in the last 50 years. So the number of cases in the world are really many, and also the related death. And as you can see, that increase in 2024, we will see the figures in 2025. But because of climate, we need to consider that dengue is a priority disease, and we need to consider that in many areas that were not populated by Aedes mosquitoes, now the disease can spread locally because we have Aedes. So this is more or less the epidemiology. As you can see, by 2050 it is estimated that around 50% of people will live in areas where we have the optimal condition to have mosquitoes and the spread of this virus. It is also known now, because the disease has spread many parts of the world, so we are enhancing the power of research in this area. Every time that diseases go out from their typical area, there is an increase of research, and what we are observing is that indeed monkeys and humans, but also other animal species may play a role and can be also the one that allow the persistence. For example, some bat species can be included. This is a very interesting paper that I recently read. It's a Nature review, and they have compared the spread of dengue from the sylvatic areas to urban area, because it is known that there are two very separate cycles from the wild and urbanized areas. But this is the case in Africa and not in southern eastern countries. So in Asia, in many countries, there is no separation in between these two cycles, and also the serotype that circulate in the wild and in urban area are more or less the same. But indeed, humans are very good host to amplify the disease locally, so when it arrives in an urbanized area, it can spread among humans. So if you want to take note, this is a very interesting paper. And this is a systematic review that tried to identify which other animal species may be relevant in the spread of dengue. So it's not just monkey. At the beginning it was just monkey, mosquitoes, and humans, but we are collecting evidence that there are other animal species that may play a role, so it is important to in-depth this area. As you can see, in Africa there are not so many studies. Many of them are performed in Far East. And yeah, this is what happened in Europe. So dengue happened in Europe in the late 20s. So we tend to think that is a recent acquisition, but we can consider it a re-emerging disease because we had it already. And then we had another big outbreak in 2012 and 13 in Portugal, Madeira. And then in 2024, we had more than 500 cases, 200 of which were in Italy and very close to our little lab. And so it is quite, now we are trying to test all the blood donation that we have, not only for West Nile, but also for dengue, because we are quite sure that we may have patients that do not feel the symptom of the disease, but may be donors and may cause problems to the recipient. So this is the graph from the Lancet Countdown, and also this graph shows that there is a peak in the last year of incidence, and so this is another very good indicator of the impact of climate on health. We tended to observe dengue in urban areas because before having these clusters that are autochthonous cases, we tended to have this disease located where most of the travelers come back. So tourists come many times from urban area, and many of them come back with the disease. But now there is not so much separation in between the ecotone and the urbanized area. So this is the situation in the last 3 years in Italy. As you can see, this is where our living lab is located. So from 2022, we had just imported cases. Then we started to have autochthonous cases in 2023, and in 2024 we had more than 200. Mainly located in a region that is exactly on the border of our living lab. So we speculated why it didn't go beyond the border and it stayed just there. We didn't observe any case. This year was better, not so many cases. Some of them were imported, the most part were imported, so we don't know why. This year we didn't have so much, but we had other things. So probably there is, we need to study why we have these kind of peaks that are not constant. Yeah, chikungunya. Chikungunya is another one. So we are in the genus alpha virus, and so it is a disease that causes fever and pain in the joints and rash. In our region, and in particular in our living lab, we had a cluster of more than 200 cases here between Bologna and Cervia in 2007. And this was caused by a traveler coming back from India, and also the phylogenesis showed that it was an Indian strain. But it circulated for a long time, for months before stopping the outbreak. That was a great training for everybody, and it was probably the first time after West Nile. West Nile was not so good in showing that we need to collaborate more in between sectors. But with chikungunya, they provided really the evidence that collaborating in between human doctor, entomologists, and vets would be a very good idea. Even if chikungunya is not so related to the animal world, it is, but not as West Nile. Vets played a very important role in this story. And then in 2017, we had a big outbreak near Rome and in the very south of Italy. This is the epidemiology of the disease. As you can see, for what we know till now, what we observe is that we have the cycle that recognizes the human as reservoir, but also non-human primate. And many times the disease is imported in Europe through infected traveler, and so we have imported cases, and then we can have autochthonous cluster. Again, it's Aedes that transmit the disease, so we don't know, because this year we had big cluster of chikungunya and didn't observe so many dengue, so we were speculating if the mosquitoes were too busy to transmit chikungunya, so they didn't have room for dengue. So this is the situation in Europe. As you can see, chikungunya affected France, Corsica, some Spain, exactly in the part that is facing Italy, so the Mediterranean, and all over Italy, and some cases also around here. So this is chikungunya 2025. We have more than 300 cases. This is quite scary because it's coming back, and so we need to take care of it. And Aedes albopictus is very happy to be the boss for this virus. And we have so many, and they are very nasty. They don't die. They can squeeze them, but they don't die. Not easy. And another one that probably is exotic to you is Toscana virus. So it is not by chance that we call it Toscana, because it happened to, the first cases were here in this part of Italy, where Toscana is. Probably everybody knows Firenze. Firenze is the capital of Toscana. So virus is a flavivirus that is transmitted by sandflies. And sandflies are able to, are vectors also for other, like Sicilian and Naples virus. They are very Italian sound virus because they were isolated there. And these ones were isolated by sick soldiers during the World War II. And flavivirus normally cause mild fever, and so they are called 3 days fever. But Toscana virus in particular has a high level of, he likes a lot our brain, so he goes there and it causes a lot of problems. So the tropism for central nervous system is quite confirmed. So Toscana virus is one of the main causes of aseptic meningitis in Italy and in some parts of Europe. It's particularly neurotropic and neuroinvasive, and also it can cause other complications like Guillain-Barré or hydrocephalus and others. Indeed, patients tend to be, well, the most affected ones are elderly again, so the most fragile part of the population, and I want to stress this because the World Bank was underlying the fact that we are not suffering the effect of climate change all at the same level, because there are vulnerable parts of our population that are suffering more, so we need to take care of them. So this is where we are with Toscana virus. Italy is very, very, very purple. So we are the country of Toscana virus, so you can read here in the table how many cases we collected and we recorded, and this is the cycle. We don't know which animal species is or act as a reservoir, but many animal species has been found positive, so they have antibodies. So it was speculated that some of them may play a role in the cycle of this disease. These insects are very much liking trees. So I'm saying that because I will show what we are doing in our living lab with this. So they live in very special areas, and so it is not by chance that we collect the highest number of cases in that areas. We have different lineages, A, B, and C, and this is how the lineages have been spread throughout Europe. So we have mainly A, and then France has both of them, and then we have Greece and with lineage C. So it is important to know, because when a new lineage happens, you can speculate what happens with the spread. So maybe tourists, somebody that came back with a viremia or something like that. This is important. And it is not by chance that Spain and Morocco share the same lineage, because they are very close by, and there is a lot of movement of people and animals from that area. And these little mosquitoes are able to move passively through the wind. So this is another very important part of the story. We experienced that also with blue tongue. In 2000, it was the wind that blew the vectors of blue tongue. And we have Tunisia. So this map is not very good, but Tunisia is very close to Italy, very close to Sicily. So we can share the lineage because we are very close by. So the highlights: Toscana virus is a cause of aseptic meningitis in the Mediterranean countries. Patients are younger than the others that we have seen before. So it causes fever and headache in the less severe cases, but it can be also lethal. And yes, so the CSF analysis can be, indicative of a possible Toscana virus infection, but many Toscana virus cases remain undetected. So probably we have many more patients that develop this viremic phase. Sometimes viremia can be very long, especially in the ones that do not develop symptoms, but we are not looking for them. So this is the situation, and this is what happened this year. The location of the cases is mainly in the ecotone, where we have the mixture of domestic and wildlife and people, so rural areas that are very close by wild areas. So the peak is during the hot season, and this is the environment that they like. So a lot of green. They like trees, they like bush, and here is where our entomologists are capturing phlebotomus. So I want to bring back to a very important document, because then I want to take you in the living lab. So I don't know if you are familiar with this scheme, the pillar that were depicted by the One Health Joint Plan of Action. I don't know if you know it, this very important strategic plan that was supported by the One Health High-Level Expert Panel. So as you can see here, the action track number 5 is controlling and eliminating neglected tropical and vector-borne diseases. They identify climate as one of the main causes. It's not only that, but we know that environmental impact of human activities together with climate change are very impactful. They concluded, together with, again, the World Bank, that we need to invest more in prevention. We need to be more strategic in that. And because World Bank, as you know, is financing and funding a lot of projects all over the world in many fields, after the pandemic, they were very focused on trying to estimate the cost of pandemics. And they concluded that indeed it is better to prevent than to be prepared. So we need to prevent, and we need to adopt a One Health approach, because this is a core to health security and in an investment in humans' future. So if a World Bank is saying that, we need to operationalize. So One Health is a very tricky concept, because it started from here very simple, and then it complicated, but again with a very ecologic perspective, where we treat animals as food producers, we share medicine, because they are also the ones in which we test the medicine, we share the environment indeed, but then this theme became more complicated, because it's not just how we behave with animals, how we interact with them, but also many other social factors are contributing to what we observe in terms of, for example, emerging or re-emerging infectious diseases. I have mentioned many times the importance of global traveling. This is very important, and this is not something that is related to animals, or is related to our behavior, what we eat, where we live, how we behave with our environment, deforestation, and this kind of stuff. These are all important. Consider the impact of war. What is the impact of war? Many times when you have a war, the first thing that doesn't work anymore is vet. Veterinary service do not work anymore, because all the humanitarian aid are just focused on humans. So you don't know what happens in that area. You don't know. You don't have a clue of the spread of infectious disease in areas that maybe are just on the border of other countries that are not in war and may suffer of diseases that spread. So it is very important to consider that war, conflicts are important, migration are important, how we produce food, and so on. So this is where social scientists come to play. So it's not just something that implicates the collaboration between medical doctors and vets. Because we need anthropologists, we need to understand the situation through political scientists or social scientists that understand the system. Because every part or every community where we operate may be different. So we cannot use what you find here and translate it into a European setting, or export what we do in Europe here, because we are different and we have different environment, but also different habits, food habits or agricultural management and so on. So this is what the One Health high-level expert panel concluded. So One Health is healthy ecosystem, healthy animals, healthy humans, but most of all is collaboration and communication. So this is, I think, the 4 C's that matter more in what we try to do in our living lab that we are exploring just now. So just remember communication, collaboration, coordination, and capacity building. So it is important, because when it comes to health, everybody thinks that only medical doctors can do their job, but it's not. So we need vets, we need entomologists, we need biologists, we need environmental scientists, we need physicists to understand, for example, the climate data. We need social scientists and so on. So, and also we need to be transdisciplinary. So it is not an academic exercise that we do when we want to put in place and operationalize One Health. Is that we are also able to work with communities, with policymakers that are the ones that decide at the end or fund your project. So trying to report, not only for a grant, but also we have found this, we did this and it worked, or it didn't work. It's important because they are engaged, and if they are engaged, they will collaborate more with you. So in Europe, they realized that we have different directorates dealing with health. So we have the directorate that deals with food, animals, animal health and welfare, and we have the DG Santé, and we have the DG Environment, we have all this. So they founded the One Health Directorate at the Commission. So this directorate is the one that makes everyone talking. So they coordinate the different directorate when it comes to collaborating in a One Health perspective. Also, as you know, in Europe we have 5 agencies that report to the Commission and to the Parliament. One of them is EFSA, the European Food and Safety Authority. This agency is the one that coordinates the ECDC. We also have the CDC, but it's the European one. And the other agency to try to have a cross-agency One Health workforce. And this is what we do as universities. This is Una Europa and what we do when it comes to One Health. So everybody is trying to solve the health of everybody on this planet. Sometimes we are not very able to collaborate. So the 4 C's are not really in place. So we go into the lab. Is there any question? No? Okay, so we are here. This is Emilia-Romagna, this is our region. So we are in between Milano, we have Venice, Florence, in a very convenient place, but also very peculiar when it comes to agriculture, social, political features, and climate. So this is Romagna, so this is the part that I want to deal with. So it's part of the region, so it's the southeast part of the region. And as you can see here, these are the floods that were suffered last year, or in 2023 and last year. So it is very prone to extreme weather events. We experience extreme floodings. This is one of them, so these are houses in between water, and this happened many times in 2 years, okay? So you can imagine animals or farms and cities, everybody had water inside their house, and so a lot of animals died and so on. So why? Because the average temperature during the winter have increased a lot. We are far over the average of the last 20, 30 years. So this is the data, so we cannot deny that. So it is hot, and we cannot deny, and this is very also humid. And I also want to show you that here, and I will explain later on, here there is the big Po Delta, so our biggest river in Italy is Po, and there is a very peculiar national park that is on the delta of this river, and this is influencing a lot the climate that we have and also the ecology of different animals in the area. So this is our living lab. So it is just a part of the region. Less than 1 million people live here, but during the summer, because you see we have the sea, so everybody is very happy to come here for a holiday. We have beautiful parks and national parks nearby. So less than 1 million people during all over the year become more than 10 million during the summer, okay? So a lot of people come from everywhere in the world. So we have a lot from Italy, but also from Europe, from everywhere. And many times these people are just bringing their pets, indeed. So they are not just people, but also animals. Sometimes they bring something, sometimes they bring back something, so it's important to, of course, it is a matter of communication. You cannot scare people and say, we have some leishmania endemic area here, so don't go there, because people that have an hotel there is not happy. So you have to prevent, so you have to work on the environment so that nobody takes any disease back home as a souvenir. Okay, so this is how it works. So we have the two green, big green, these are our wild areas. So I want to bring you back to the ecotone, wild and urban. So these are two national parks. Up there you have the Po, Delta del Po National Park. This is a very humid area. Okay, so who lives there? A lot of aquatic birds, a lot of insects, a lot of deer, different kind of deers. A lot of people like to spend time there, but it's full of mosquitoes, I promise you. And also, in this yellow arrow, you can see another humid area near Marina di Ravenna and Cervia. I don't know if you are, we have a very popular salt that is called the Sale di Cervia, that is the sweet salt that we have. It was called the Pope salt, because our popes were very keen on our salt. But this is another very wet area that is full of birds and mosquitoes. So it is not surprising that this area is so affected by arbovirus. So we need to consider. And then we have this national park. This national park is on the mountain. It's in between Emilia-Romagna and Toscana, so where we have Toscana virus. And it's full of wildlife, even if you tend to think, indeed, you are in Africa, you are in the third country for biodiversity, and if I'm not wrong. But we have a lot of wildlife, and it's interesting because in this area, there is a lot of overlap with ecotone. So the blue is the ecotone, where we have a lot of animals, farm animals, mainly. So when these animals go for their pasturing things, and they come into contact with these animals here. So it is quite a mixed area in terms of overlaps and possibility to have this intermediate jump before going to humans. The only industrial farm that we have in the area that is in the most urbanized area, this orange, is the poultry. Why we have so many poultry there? Because in the 60s and 70s, when the first German came for holiday, this was the cheapest meat to give them in the hotel. And because they didn't want to spend a lot of money, we decided, well, Romagnoli people are very, they are very skilled in business. So they said, okay, poultry, they are very small, we don't have so much space, so we can give poultry meat to the tourists. And then indeed, in the urbanized area, we have a lot of pets, we have horses and so on. Then we have another very peculiar area here, that is the purple. This is an area where farmers all together, so the crop producer, but also animal farmers and so on, decided to get rid completely of any chemical. So they don't use any chemical for their production. It is called the biosymbiotic district of Romagna. They produce beautiful food and they work on the microbiome of the ground. So they are able to grow beautiful crops because they have a very rich, bacterially speaking, or microbes speaking, ground. So they don't have to use any fertilizer and so on. Indeed, if you don't use any chemical, insects are very happy. So there is, a balance or not. So this area here is where we operate. But there is not only that, because they are very, as I said, business-oriented people. We also have mussel farm and fish farms, a lot. Of course, when you are on the ground, you don't realize that we have so many, but we have. And when we had flooding, we observed what is the effect of these guys there, even if we were all looking at the ground because everything was destroyed. So, climate-sensitive infectious disease. One is Vibrio. So, if you look at this green area, this was identified as one of the most at risk for Vibrio cholerae. That is one of the indicators that is included in the Lancet Countdown. And this area is exactly the one that was flooded during 2023 and 2024. What happened? We were all very, very focused on the ground. We were scared about tetanus, leptospirosis, and all these kind of diseases that may spread during a flooding. But we were surprised because we have seen cluster of these diseases. I don't know if you ever seen this, but these are all elderly people that just probably 2-3 weeks after the flooding were on the seaside, as the elderly do. They walk in the shore, you know, in the water, and many of them, some of them developed this very nasty disease that is called Vibrio vulnificus. That is a vibrio that eats the our muscle and skin. So Vibrio vulnificus is a very underestimated zoonotic pathogen. Indeed, it spreads as Vibrio cholerae, but we don't really do a proper surveillance because we are very focused on Vibrio cholerae. But we know that fish farms and also mussel farm can act as evolutionary drivers for these diseases. And when you have a flooding, you have also a change in the salinity of the water around, because our sea here is like a big lake, you know, this part of the sea is not really open, and the salinity is also influencing. So these people were just walking here, and some of them unfortunately died. But you see, this is the effect of Vibrio vulnificus. So it's not arbovirus, but just to say that we have to consider that there are fish farms there, and this may also be the cause. And we know that the biologists taking care of fish farms were collecting data on Vibrio, also Vibrio vulnificus, but there was no counterpart in the medical side. So public health was not involved at all. They just gave them the Vibrio cholerae data because that were the indicators that are important for to allow swimming in the water during the summer. This was a very big problem because the communication should be very careful, because you don't want to scare tourists with this. So you have to act very, very quickly to try to solve the situation. It was not good. Then, another very important part of the story is that we started very soon in our region to apply a One Health approach to vector-borne diseases, especially West Nile and leishmaniasis. And I think this is a very important piece and should be followed by others, because to convince policymakers to put in place and operationalize and believe that One Health is useful for everybody, you have to provide data on the economics. So how much did we save applying this inter- and transdisciplinary approach to the control of vector-borne diseases? Well, we saved a lot of money, and we have just focused on insects, animals, and blood donation. We didn't do anything on patients, but we were able to demonstrate that screening the blood saved a lot of life, hospitalization, and so on, and many other clinical cases. So I think this is so important. Well, it's an evidence that you need to provide to policymakers to say, okay, we need a Department of One Health, we need to work together, we need to modify our inside way of working. So this is not by chance. Well, it's in Italian, but believe me that we have in our regional plan for prevention One Health mentioned many times, not only for vector-borne diseases, but also for foodborne diseases, including Vibrio and others. So it is important because now in this area, One Health is not just something that we say in the academia, but it's something that is compulsory by the regulation that we have in the public health. I want also to clarify, and I think we are the few in the world that manage human health and animal health under the same ministry, so we don't have a separation, Ministry of Agriculture, Ministry of Health, and we do everything together, so vets and human doctors work in the same ministry. And the chief of public health in our region is a vet. So we don't separate this, so you cannot be the chief of public health because you're a vet. No, you know how to prevent diseases, and he did very well during the pandemic, so this is why he's in charge. So, thanks to the collaboration that we have with Bariki, because she's very keen in syndromic surveillance, we started to, and because I'm a curious vet, I went to the database and I wanted to see what happens during the different months of the year regarding the diagnosis of different diseases that cause fever and neurological signs. When we collected all this data, we organized some gathering with doctors, so the chief of infectious disease, neurology department in the hospital, and then vets, but also the environmental scientists, academia, some policymakers in the public health sector, to try to do something together related to the unknown, because this is what we are able to detect, but there is a lot that we are not able to detect. So this is where we have to work. So we started also collaboration, like a genomic surveillance plan that integrates the data of the genome of the viruses that we collect from insects, animals, and patients, and we put everything together to understand if there is something that we miss in the whole picture of arbovirus, and this is what we did for Toscana virus, lineage A. And we discovered that urine is a good sample for doing NGS, and this is very convenient because, as always happens, for these viruses, the viremia is very, very, very brief. So we need to go for other samples that allow us to identify also the ones that do not have neurological signs. Regarding West Nile, we were able to do more or less the same with insects, animals in different parts of the living lab. All together, we reported about our variants that are able to overwinter. So we don't have to expect insect that comes, or they all live there, they survive the winter, and they keep on our lineages of the virus. And it is interesting because these are the same that circulate also in up north of the park, and because the same mosquitoes are moving into the Delta Park. So we have this overwinter, so it is not surprising that we have this hyperendemic area. And this is another story. So all the blue here is what we are not able to detect. So many patients during the summer, and we did this as a retrospective study from 2017 until 2023 and now 2024. All this blue are the patients that go out of the hospital with the diagnosis of fever of unknown origin. So we have a lot of fever cases, especially during the at-risk season where we have more vectors around, but we're not able to identify the cause, okay? So the peaks are always during the summer, so it's not surprising. The thing that was quite upsetting is, despite the fact that they were more or less all negative for any bacteria, more than 60% received antibiotic therapy. So we are talking about AMR, we are talking about the risk, and what we do in the vet field. We are the one that should be blamed because we are the ones that use not properly the antibiotics, but I would have something to say. So we gather our medical counterpart and all the people in the group, and we said, okay, look, you had more than 3,000 cases of fever of unknown origin in the time that we considered. Probably we are not able to identify the agents because it's not included in the panel of diagnostic that we are currently using. But if you have a patient that is negative for any bacteria, why you are using these antibiotics that are unusable? And also, they have defined these cases as fever of unknown origin that are defined as a fever of more than 38 degrees for 3 weeks, but all these had an acute fever that lasted less than 9 days. So it was very strange. So just to conclude, we wanted to map our cases of fever of unknown origin in our living lab, and we identified 2 hotspots. These are the hotspots that overlap with Leishmania, so with other sandfly-borne disease. And And so these are also the area where we had the highest number of phlebotomus that were captured. And we know from our very curious entomologists that even if they are there to test for Leishmania, they are not happy when they don't find anything, and they go on and on and on. And they have found a lot of other flaviviruses that we are not able to identify with our diagnostic panel. So we think that we need to include them into our diagnostic panel to identify if these are causes of fever of unknown origin during the summer season. Also, our very curious entomologists, which are screening for West Nile virus and Lesotho virus, described Taenia virus that is circulating in the same vector. So probably there is also some Taenia virus that is already known as a cause of febrile neurologic syndrome, but not in Italy yet, that can be implicated in these symptoms. So to conclude, we think that in that area, probably also ticks may be relevant. We are not very good in monitoring tick diseases. Probably it's not tick-borne encephalitis, but probably other things. So this is what we are doing. And as you know, as you see here, as a transdisciplinary approach to our collection of ticks, we have involved also the farmers, because they have to know, they have to understand that ticks are dangerous, not only for their animals, but also for their health, and they have to report. And we have also identified some strange guys that shouldn't be there. So, to conclude, this is how we try to operationalize One Health in a little part of our region. And here we have different academic settings, like we have 2 courses of medicine, 2 programs of medicine, 1 of vet. We have Animal Health Institute, we have the Cancer Institute, we have a big microbiological hub, and we all together work with people that work in the national park and policymakers and public health authorities to try to solve the health threats in the area. So the lesson that we have learned so far is that we need to engage partnerships. So I want to go back to the World Health Organization and One Health high-level expert panel. We cannot do One Health just to collaborating in between vet and medical doctors. We need to perform more syndromic surveillance, and we have to share all genomic data as possible, as much as possible, not being jealous of our data, but sharing. And we have to define our indicators. For example, Vibrio vulnificus should be included because it's one of the indicators of the flooding that we have. These are all the team, the people that collaborate in the living lab. So we want to shift from ego to eco very soon, and we want to be, you know, a good practice that could be shared. Thank you for your attention.
Often when you work as a doctor, I started to see other scientists ask the doctors to send me their cases of febrile disease or neurological disease. I can treat it, so I'm not going to send it to you. And so I wonder if you have you looked at those cases that remain negative, whether it's maybe a problem that you should do serology, as we discussed, rather than molecular diagnostic, because I'm also a molecular biologist. We like to test with PCR and everything, and sometimes it just doesn't pick it up.
Yeah, we tried to do molecular, but we didn't succeed. But it's not surprising because of this very, very short viremia that many patients have. So I think we need to integrate the serology very soon for our different pathogens that are circulating. But not only the pathogen, the microbes, because the flavivirus that we have identified in the cell type, we don't know if they are pathogenic for humans or for animals, we don't know. So these agents are there, so we should look for them in any way, or at least see if the patient is positive for flavivirus, and then try to sort out which one, or Taenia or others. So
I also think so for arboviruses that's complicated, because we often have different areas have different arboviruses, and until it's deca and it's spread everywhere, people don't actually take note of it. So do you use genus-specific PCRs as well then to try to pick up wider, such as flavos?
Yeah, well, the area is not so big, but for sure, the cases associated with phlebotomus are in a certain area just there. So it's an overlap with Leishmania, and West Nile is a completely different area, is the one where we have the wet areas. Well, it's so small that it's difficult to say that there is a big difference, but we are trying to at least work with the other regions that are on the border to try to see if there is an homogeneity of the spread, but it seems like that. This is why it's so important to have an understanding of the ecotone, how big it is, and where the disease and the cases are. Sometimes when you are in a clinical microbiological lab, you just have a sample to test, but you don't know much about the patient, where he or she lives, and so on. And this is very important to know, because then you can do prevention and